Welcome back to Today with Dr. K. I'm Dr. K.Y.'s Whitehead. I'm joined now by Dr. Mark Ratner, a board-certified urologist and the Chief Science Officer at Theralogix, a health and wellness company founded by physicians and scientists. He is also the author of Heartburn, Acid Reflux, and GERD, What You Need to Know, based in Rockville, Maryland. How are you this morning, sir?
I'm doing well, thanks. How are you?
I'm doing well, thank you. Could you please just begin by telling us, what does GERD stand for?
So GERD is an abbreviation for gastroesophageal reflux disease. Now, what this is basically heartburn that happens more than a few times a week. So, everybody gets occasional heartburn. But if that becomes a chronic problem, if it's something that's happening day in and day out, the doctor is going to basically say, well, you probably have GERD, gastroesophageal reflux disease. It's a chronic form of acid reflux from the stomach back up and towards the food tube.
Now, can you take us back to the moment that landed you in the emergency room with an irregular heart rhythm? Was that connected to GERD?
Yeah, it was. It's a slightly embarrassing story. About 5 years ago, I woke up in the middle of the night. My heart was just pounding. I felt like it was going to come out of my chest. And, I'd been a doctor long enough to know something was pretty wrong. Woke up my wife. I said, we got to get to the emergency room. A few minutes later, I'm laying on a gurney. They're doing an EKG. I had an irregular heartbeat. They did a bunch of blood work. It turns out I had a very low magnesium level. Happily, they gave me some medication. It corrected the problem. My heartbeat went back to a normal rhythm, and knock wood, in 5 years, it's never happened again. The ER doc took a look at my list of medications and said, how long have you been taking omeprazole? Now, omeprazole is the generic name for a very common medication called Prilosec. The trade name is Prilosec. And it's one of the most, I think it's the fourth most common medication taken in the United States. It's an acid blocking medication. It stops your stomach from making acid, and it relieves the symptoms of GERD. I had been taking that for like 15 years. And unbeknownst to me, it had dropped my magnesium level to the point where my heart wasn't beating normally as a result of that low magnesium. So this was a revelation, not something I had any idea could happen. And so that was sort of where I became, and jokingly, I say, I'm a prisoner of Prilosec, because that medication, if you take one of those medications for acid reflux, for GERD, and by the way, those medications, Prilosec, Nexium, there's a bunch of them. We call those medications PPIs, which stands for proton pump inhibitors. That's the class of medications. And you can get them over the counter now. It used to be you needed a prescription. Now you can go to Costco and you can buy them by, like the shopping cart full without a prescription. And so the problem is, once you start taking one of those medications, after a few months, you're hooked. Oh, it's almost impossible to stop. It's if you try to stop that medication, what happens is the acid production in your stomach rebounds to like 5 or 6 times higher than normal production, and you feel like you just want to die. I mean, it is just misery, and most people can't tolerate it. They just go back on the medication. So that's why I jokingly say I'm a prisoner of Prilosec. They've got me prisoner. Yeah, it's a surprisingly common problem.
Now, with Prilosec, is that found in things like, say, Pepto-Bismol, for instance?
No.
Okay.
No, it's Prilosec is a separate medication.
Okay.
The generic name for it is omeprazole. And so you can find it in every drugstore. You can go into Walgreens, CVS, and they sell it over the counter now. So it's widely available, and there are something like between 15 and 20 million Americans that are using it on a daily basis.
Now, this is not addictive in the same way that, say, opioids are addictive.
No, 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 no. I mean, look, this medicine serves a very useful purpose. The problem is that it has side effects, and one of those side effects is nutrient depletion.
Okay.
And it not only depletes magnesium, it also depletes B12. And it's not the only medication that we know of that does these things. There's plenty of medications that serve a really important purpose. Another great example is metformin. Metformin is the single most widely prescribed medication for type 2 diabetes. It's the first line medication. And amazingly, and it's a great drug, don't get me wrong, metformin does a wonderful job of lowering people's blood sugar. And it's been around for many, many years. It's generic at this point. But it also can lower magnesium and B12. And so the FDA, back in, I think, 2011, the FDA issued a warning that people who are taking metformin on a daily basis should supplement magnesium and have their magnesium levels checked. But these are not widely appreciated. These potential problems, not everybody is going to have the problem. I just sort of was unlucky, I guess. But these are not that widely understood, especially even by doctors.
What's interesting, my son always jokes whenever we see those commercials where they talk about taking a drug, and you see all these beautiful images, but underneath the voice is going and listing all of the side effects that can happen.
And at 100 miles an hour, right?
Yes.
That's right.
Yes.
Yeah.
So are there other little known dangers of popular pills that most Americans use?
Well, look, we are, I think, as you said in the introduction, I'm the chief science officer for this company, and we focus on nutrition. We make prenatal vitamins. That's the kind of stuff we do. And so, in a sense, when I found out I had a magnesium deficiency and it had landed me in the emergency room, I was in a position to say, okay, I think I know how to fix that, right? And so I just started supplementing magnesium. And so what we're focused on, just because that's kind of what I do professionally at this point, are nutrient depletions. And there are other examples. So for instance, there's many people for high blood pressure get put on what's called a diuretic, a fluid pill.
Right.
And this has been around for many, many years. But many of the diuretics will make you lose potassium. You lose potassium in the urine. And so what the doctor will typically tell you if he or she puts you on a diuretic is they'll say, eat an extra banana, eat a banana a day, because the banana has potassium in it and it's going to keep your potassium level from dropping. The statin medications, things for cholesterol like Lipitor and Zocor, Pravachol, these are very, very common medications that are prescribed. Those medications block your body's own production of something called coenzyme Q10, which is a very important molecule in our bodies. Our body is supposed to make it itself for energy production. And so people who are taking statins for elevated cholesterol over a long period of time, their body's coenzyme Q10 levels are going to drop. And so fortunately, many of these issues can be dealt with by very specific types of supplementation. Not the kind of supplementation you'll just get in a multivitamin. You have to sort of target, what it is that you are potentially going to be lacking.
Now, with that in mind, when people think about having their levels drop, if their magnesium levels drop, or if they develop a vitamin B12 deficiency,
right,
are there ways that you can supplement this where you don't have to get on more medicine to help correct what other medicines are doing?
Okay, so it's a great question. It used to be, if you had a B12 deficiency, the doctors used to say, hey, come in the office once a month, I'm going to give you a B12 shot, right? But now we know that there are actually oral forms of B12 that you can take that are well enough absorbed. I mean, the reason they used to give shots is because you couldn't get B12 that was absorbed well from the stomach. Now we have forms of B12 that are very well absorbed. And so you can take an oral supplement and deal with that issue pretty simply.
Now, does the FDA have a lot to say about these medications? Have they issued health warnings? Maybe I've missed something that's come out.
No, I think, look, it's been pretty well documented. If you read the FDA warnings over the years, they do mention, monitor the patient's B12 levels, monitor the patient's magnesium levels, both with metformin and the PPIs. And I should mention also, by the way, anybody who is listening to us and is taking one of those medications should absolutely not stop the medication or change anything about their medication without talking to their doctor first. I want to make that real clear. But if these are issues that potentially could be affecting them, there are some simple steps that they can take. There are diet and lifestyle steps, okay? I mean, the PPIs, the things like Prilosec and Nexium, besides lowering B12 and magnesium, they can increase your risk of osteoporosis. They can increase your risk of actual kidney problems. There's even some data, and this is a little bit still controversial, there's data that they might increase your risk of dementia if you're on a PPI long term. So there are steps you can take to try and eliminate your need for these medications, okay? And in fact, I have a ebook about each of those particular medications that goes into, how can you get off a PPI? What are the steps you might be able to take? If your listeners want to go, it's just called PPI Help, HELP, PPIHelp.org, O-R-G, and they can download that ebook for free. And the other one is called MetforminHelp.org, and they can get a book about kind of diet and lifestyle steps for managing type 2 diabetes, and as well as these potential side effects. So yeah, I mean, this is it's a problem that's out there, and I don't think many people are all that tuned into it. Even doctors.
Well, I think one of the problems, as someone who's not a medical doctor, I'm not a research scientist, I'm not going to count my hours on Google because that's not like medical school. So in the real world, I don't know.
Sure.
So I sit in the chair and my doctor tells me to take this, this, and this. And they tell me that, the benefits will outweigh the risk. So you just start taking it without even realizing or recognizing all the other things that can happen. And so it's because it's not that we're uninformed, it's just that we trust or believe or hope that the doctors have more information than we do.
Well, I think I would say that probably in many instances, you're only partially informed. And that's really, in some respects, the fault of the healthcare practitioner that you're talking to. A lot of doctors, they have to move at the speed of light. They're just cranking through patients all day. And if the doctor says, I want you to start taking this medication, and they're in a rush, they may forget to say, by the way, there are some common side effects that you might see. Don't be alarmed if you notice X, Y, or Z. Or, we should check your B12 level in a few months and make sure it hasn't dropped. So unfortunately, those kinds of cautions often do fall through the cracks.
What's interesting is that I find myself in situations like this, and I haven't been on a lot of medications, but I find myself asking the pharmacist. I mean, I'm the one in the line saying, I actually do have a question because I want to know, only because what you just said, there's so many steps and you open up and read all of the list of things that could happen. How do you know what's the emergency one and what's just the normal one? And
Sure.
should pharmacists be a line of defense for this?
Pharmacists actually have a role to play. There's no question about it. Yeah. And sometimes the solutions are simple, and other times they require a little bit more of a conversation. Unfortunately, I am still a prisoner of Prilosec.
Right.
I've tried all of the different diet and lifestyle things to try and get relief from my GERD, but I can't get off the Prilosec. And so I just basically take a supplement. And I take a high absorption B12 and magnesium supplement. And luckily for me, I was in a position to kind of even help develop that. So I basically take every day a very inexpensive B12 and magnesium supplement because I'm stuck on Prilosec, basically.
Dr. Mark Ratner, a board certified urologist, chief science officer at Theralogix, a health and wellness company. Go and get his book, ppihelp.org. You can download that ebook for free. He's also the author of Heartburn, Acid Reflux, and GERD, What You Need to Know. Dr. Ratner, thank you so much for just sharing this information with us.
My pleasure. Have a great day.
You too.